Governors say that they don't want this bill, and they're urging their senators not to say yes to it. 10 governors, 5 Democrats and 4 Republicans say this is not the right idea. That's a number of states who say that they should not have the powers that the Graham-Cassidy bill will be putting forward.
Well, each governor gets to decide what they think is best. I'd ask them to understand it first, and I can understand if you're a governor from those 4 states that get 40% of the money, and there's only 20% of the population that they wouldn't be happy about this.
This is 10 governors from 10 states.
I understand. And many of those are in states that expanded Medicaid, which is a program that has now failed as a result of the expansion specifically related to the fact that people that Medicaid was designed for initially have been lost and left behind because of all these additional people put on Medicaid.
There's widespread popularity for Medicaid right now. Medicaid seems to be the only thing that is working.
Well, I'm going to disagree with you on that.
About the exchanges,
no, there's not widespread
Medicaid.
popularity for Medicaid. We know that 1 out of 3 doctors won't take new Medicaid patients. We know that it's harder for people with Medicaid to get care. We know that their results of treatment are worse. There is not widespread popularity. There's widespread popularity by certain governors to take the money from Washington for the expansion of Medicaid, but for the patients who are actually on Medicaid, and I'm a doctor, I was in my medical office last weekend in Wyoming, I will tell you, Medicaid continues to have failed the American people, and the expansion of Medicaid has made it worse for people that Medicaid was originally designed for. The low-income women,
Senator,
the children, and the disabled, they have been left behind as a result of so many people being jammed onto Medicaid, which is why it's harder for doctors to take care of them.
The majority of the people in this country have favorable views, are favored toward Obamacare. They have not been favored toward anything that the Republicans have put forward so far in Congress. I want to talk about essential health care benefits. There are not protections for essential health care benefits in this bill.
And there shouldn't be. There shouldn't be. The essential health care.
Can you assure people in Wyoming that they're not going to lose their health care because of a pre-existing condition?
Those are 2 entirely different things. This bill protects everyone with a pre-existing condition. My wife's a breast cancer survivor.
Can you assure that their costs
3
are not going to go up?
She's been through chemotherapy twice, been through radiation. Well, can you keep interrupting if you'd like? I'm trying to answer your first question. The essential benefits was the Obama approach that said you have to buy all of these different kinds of health insurance, a lot of which you don't need, can't afford, don't want, isn't right for you and your family. But President Obama said he knew better for you than you knew about you and your family. It's the #1 complaint I get in Wyoming. The costs have gone up so much because people had to buy insurance they didn't want, didn't need, and can't afford. I want states to have the option to opt out of the essential benefits. I believe people with pre-existing conditions need to be covered for those conditions. As a doctor and a husband of a wife who's had breast cancer, I am committed to that.
Senator, I just want to know one thing. Can you guarantee the people of Wyoming that the costs associated with their pre-existing conditions will not go up so much so that they will not be able to afford it?
The costs have gone up already under Obamacare,
I'm asking this for Graham-Cassidy. I'm not talking about Obamacare. I'm asking this for Graham-Cassidy, which is something that you're going to be voting for. So I'm just asking you,
more money is going to come into Wyoming as a result of Graham-Cassidy. More money is going to come in. When you have people that can't afford their policies, which is what I heard about this weekend, we're down to 1 insurance cover under Obamacare. Only 1 is selling insurance in Wyoming.
I'm just trying to get you to answer the question that I asked, which is, can you guarantee the people of Wyoming, let me finish my question, and then you can answer it. I'm not talking about Obamacare. I'm talking about Graham-Cassidy.
Well, you should, because it's failed.
Respectfully, this is the you are voting for. This is the bill that your constituents, the people of Wyoming and the people of America, will use for their health care if they don't get it through their employer. So can you tell, let me finish, can you tell your voters, the people of Wyoming, that the costs associated with their pre-existing condition will not go up so much that they will not be able to afford health care coverage?
People can't afford it now, Katie. I don't understand what you don't understand.
Senator.
If they can't afford it now, we're trying to get more people able to afford it, which is why there's additional money coming to Wyoming under Graham-Cassidy. It will be easier to afford under Graham-Cassidy than they can do now under Obamacare, where rates are supposed to go up again next year. by a huge number. They're talking 30, 40% increases. Again, whether you have a pre-existing condition, whether you don't have a pre-existing condition, just being alive in Wyoming right now, you're being hammered with huge costs, and it's all a result of Obamacare, which is why Donald Trump got 70% of the vote in Wyoming. People were absolutely fed up with what the Democrats have done
Senator,
across the country.
Thank you for answering, I guess, about Obamacare. Again, I was asking about Graham Cassidy, but I have a whole other 45 minutes of a show to do, so I'm going to have to leave it here. Senator Barrasso, thank you so much for joining us.
Congratulations on your book. It's doing very well.
Thank you very much. I hope you get a chance to read it. I do appreciate that, sir. Thank you. And come back anytime. I'd love to keep talking about this. Absolutely.
Thank you.
Thank you. And on the issue of repealing Obamacare, Senator Lindsey Graham is using Bernie Sanders' push for single payer as a rallying cry for Republicans to get on board with his plan.
Behind me is the only thing between you and single payer health care. Bernie, this ends your dream of a single payer health care system for America. So we need people on board now to stop what I think is inevitable if we fail. We know how this movie ends if we don't change. We're going to have a single-payer health care system in this country that's going to bust the budget, and we're going to start rationing care like you've never seen.
And joining me now is Democratic Senator Chris Coons of Delaware. Senator, thank you very much for joining us. And I do want, unfortunately,